Welcome everyone, it's Barbara Citarella and I wanted to welcome you to the Learning Lab as part of the National Association for Home Care and Hospice's annual conference. I am going to be speaking about infection control and COVID-19. I know this has been an ongoing area of concern, so we're going to touch upon some issues that are new and some that are not so new. We know that information coming from various organizations about COVID-19 infection control and personal protective equipment has really been like Mr. Toad's wild ride. We have heard, yes, we need to wear a mask. No, we don't need to wear a mask. Yes, you could come back to work in 10 days. No, now you can come back in 7. It's been a very, very disconcerting journey for all of us. And so I just wanted to speak a little bit today in the time that's allowed to me to talk about the issues of being in charge, being a leader, listening to guidance, and when it really comes down to you making decisions that are best for your organization in spite of all of this conflicting information. So I've called it Mr. Toad's Wild Ride. I know most of you have attended my other sessions on COVID, but this has been really an ongoing issue, and we know it will continue to be an issue because this is a situation that is probably not going to be resolved to sometime in 2021 for infection control and in monitoring. So one of the main issues, of course, has been the use of PPE, what types of PPE to use and when to use it. We know as time goes by, we have experienced shortages in PPE, and while we have some other stock that's available, it's not necessarily the stock that we would like to have, and we do know that there is a lot of fraudulent PPE floating around. In the moment, while we have this lull, and I call it a lull because we're not quite into influenza season, and for some states we see a little bit decrease in the statistics, but in other states, there's going to be an increase as we open up more and more. It becomes really clear that as an organization, you need to have policies and procedures, and you need to have staff that really understand PPE, and that has to come from you as leaders in your organization. So you really need to make sure that your staff, even your office staff, are trained in the donning and doffing of PPE. It's really paramount for the safety of your staff, and then of course relating down to your patients' safety. If your staff doesn't know how to use PPE correctly, then they're putting your patients at risk. But even in the office, we know as we come back to work, or even if the office has been open, it is requiring many staff to be wearing PPE in the office. So your organization needs to decide on what types of PPE will be used in the office and the field. And that will depend in the field on what types of procedures that your staff are doing. Ideally, when we're using masks for any type of aerosolized procedure, we want to be wearing N95 respirator masks. We know right now KN95s seem to be what's available to us as our market again is being flooded with personal protective equipment from other countries. So you need to make a list. It's always beneficial. Are surgical masks required or beneficial during a visit? And in your office, are you using cloth masks? What type of masks? Do they need to be washed? Are they being reused? Who's doing the cleaning of them? Who's transporting them back and forth? The one thing we do know that homemade masks are not for making patient visits. We know from a brief study that was done by the federal government from the National Institute of Medicine, very brief emergency study done back in March that there is no evidence that shows protection from homemade masks in a professional setting, in a healthcare setting. So if you're thinking of using them for patient care, I think you might want to rethink that a little bit and go back and look at research coming from the scientists. That's what we really have to focus on. But staff really need to be familiar when the surveys begin after this event or even during this event. We know that there are regulatory surveys being done at this moment in time. Just last week we had 4 of our clients being surveyed, all on emergency preparedness. Survey on PPE, what kind of stock, how do you document what stock is coming in, how much do you need on a daily basis. So PPE is going to be paramount for the next year, maybe year and a half. So I just want to, as we're talking about this, help you to understand that you have some control here. We don't hear a lot of talk about that or a lot of discussion about it, but it really is at some point in this process as we get all this conflicting information. It really boils down to leadership, crisis leadership, and how you're going to make decisions. Guidance from CDC is just that. It is guidance, and it is minimal guidance. OSHA is a regulation, but you as an organization, as you begin to hear all of this conflicting information, have to pull together your leadership team and you have to make some decisions. You can have more stringent policies and procedures, especially in this type of situation where we are dealing with an unknown biological organism. We don't know a lot about COVID-19. We know that it is very easily spread. We know that it causes major inflammation to your major organs. It changes the clotting factor in the body, and that probably based on the information that we're seeing scientifically, there is a potential here for long-term chronic events. So as a leadership team in your organization, perhaps you would think about putting together a consensus team. Now those are my words, that's how I look at it. Some people use incident command system. I'm more into consensus, that the leadership gets together and discusses some of those issues in regard not only to PPE, but overall related to COVID, and take a stand on what your policies and procedures and processes will be, documented by scientific evidence, and of course by local, state, and federal regulation. During this event, a consensus team, and however many people you want it to be, it could be 3, it could be 5, you're going to sit and have an open discussion. We don't want groupthink. We want people to second guess each other. We want to be challenged and make the best possible policies in regard to infection control and COVID. Understanding that in this event, we will see a great many legal issues. This is uncharted territory, and with that makes it very difficult from a legal perspective, because most legal decisions are determined by precedent, and we don't have precedent in this situation. So if you have not done a consensus team or you're not using the incident command system, I'm making the suggestion to please consider this. And then when your consensus team signs off on policies and procedures with governing authority approval, you can make accurate, based on information that's available at that moment in time, decisions. You can look at your decision making, your policy making, realizing that we are in crisis standards of care, when we don't have enough medication, when we don't have enough personal protective equipment. You know, we move from normal standards of care, well actually first best practices, then normal standards, then altered standards, and finally crisis standards of care, which we were in for several months, and now we kind of go back and forth in between altered standard of care and crisis standard of care. So the consensus team then discusses policy and procedure, how you're going to handle your staff, who is going to go out, what kind of patients will you admit, will you make a visit, will you do virtual, will you use telehealth. Your consensus team means that everybody, after a healthy discussion, agrees on a process and a plan and all sign off on it and document the information that you're getting, whether it's a document off of the Ask for Tracy website, whether it's an OSHA documentation, whether it's an executive order from your state, but you document all of these things to justify what your decision is at that moment in time. And especially because infection control is going to be paramount for a long time. I don't know that we will ever practice home care and hospice the same way ever again, but we do know at the root of all of our practice now, we are looking at infection control quite differently and quite honestly giving it the respect that it really deserves. Every piece of our practice now is going to go back and be looked at under the eyes of infection control. So in preparation for what I'm going to call the panfluenza season that was coming up upon us very soon, we're into October, and we know that we have influenza season, and we also know that the pandemic is still floating around. And that's going to make things a lot more complicated for our organizations, our staff, and also for our patients. So when you're reorganizing and looking at that infection control prevention program or looking at your QAPI program, the focus now should be on the fact that we are in a public health emergency. And you need to look at it again with different eyes because this is a significant piece of QAPI and our practice over the next several months. So when you look at your infection control program now, you need to be looking at it in terms of COVID and flu. So that means you need to set up a surveillance program and how often your staff are going to let you know what's going on out in the field and how they're identifying and also contact tracing, updating your policies to make sure that they are updated to the regulations and changes for COVID, making sure that your staff are educated, and of course going back to your PPE, looking at the supplies that you have, forming more collaborative relationships with your suppliers so that you know that you can go to a variety of sources to get what you need, gloves, masks, gowns, shields, whatever you need. But your infection control piece should always be underlying. So in looking at the several months coming ahead, COVID and infection control, influenza season really require you to go back and look at the plan you have in place based on what you learned over the last 8 months. And yes, it's been 8 months now since we saw some major lockdown occur across the United States. And we are just reopening in many parts of the country. And as we reopen, we are going to see more cases pop up. That's just normal as we move back into some normalcy in our world. So the infection control piece and COVID needs to be ongoing. I just wanted to spend a few minutes today in our learning lab to give you some information about infection and COVID-19. Would welcome the opportunity to speak to you more about this. You have our contact information at the bottom. Please feel free to email us or call us with anything in regard to infection control and COVID. But the main thing that I want you to remember is to be empowered, to understand that you can make powerful decisions with regard to infection control and protecting your patients and protecting your employees. So please stay on top of it, but understand with the use of a consensus team, you can make a difference in protecting your staff and your employees. So thank you for joining me for this brief session in our Learning Lab, and I hope you watch the 2 others that we have contributed to the conference. Enjoy the conference, and we look forward to seeing you in person sometime next year. Stay safe, everyone.